Welcome to Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. Salt has always been an important commodity to mankind. So important, in fact, the ancient Romans gave salt to their soldiers as a form of wage. The word for salt in their Latin dialect was sal, which is where we get the word salary. But as valuable as salt was as currency in the Roman world, it is even more valuable today, as physicians and researchers explore its role in the workings of the human body.
The ventricle, the lateral ventricle there and there.
When there's an imbalance of sodium in the body, the effects can be profound and sometimes even fatal.
I had the worst kind of flu ever. I barely would pull myself out of bed each day.
An abnormally low level of sodium in the blood can cause a condition known as hyponatremia.
It's a relatively common occurrence.
Today, we'll take a look at what happens when the sodium level in the blood is low and what patients and physicians alike can do to recognize and correct this problem.
Major funding for Healthy Body, Healthy Mind is provided by Otska, people creating new products for better health worldwide. And by an educational grant from Takeda Pharmaceuticals, North America. Additional funding provided by Regeneron and by GlaxoSmithKline and by Novartis.
Sodium is the main electrolyte in the body and is crucial for many body functions. When the sodium levels in patients' blood falls too low, this causes a hyponatremic state. Water moves from the blood into their cells, causing them to swell. Swelling is the most dangerous consequence of hyponatremia. When swelling occurs, it can affect all parts of the body, including the legs, the abdomen, and more seriously, the brain. When this occurs in brain cells, this can endanger these patients by causing swelling of the brain. Because the brain is contained within the skull, swelling is restricted, leaving less room for the brain to expand.
So that if a hyponatremia develops very quickly within 48 hours, there's not enough time for the brain to adapt. And if the brain can't adapt, then the brain will swell, and that will cause what we call cerebral or brain edema.
Due to the diffuse nature of the swelling, the brain malfunctions. Changes take place in how nerve cells operate. Such alterations can cause an array of neurocognitive dysfunctions and even death if the swelling is severe.
The symptoms associated with hyponatremia are quite broad, from relatively mild symptoms such as fatigue to confusion when hyponatremia is more significant, seizures, loss of consciousness, coma, and then, of course, the most significant change of all is death.
Other symptoms include forgetfulness, headaches, nausea and vomiting, muscle weakness, and impaired balance. Seeing that many of the symptoms mimic the common flu, how can you tell whether you're just under the weather or in serious danger from hyponatremia?
It's an easy diagnosis to make in that if you draw a blood test on someone and test for the serum sodium, which is a common test that we do in almost everyone who comes in, it becomes evident quite clearly that the sodium is low. You basically just get a number that tells you what the sodium is.
Normal sodium levels in the blood range between 135 and 145 milliequivalents per liter. A number lower than 135 will result in a diagnosis of hyponatremia. There are substantial differences in the speed in which hyponatremia develops.
Acutely developing hyponatremia is much more likely to result in symptoms, whereas hyponatremia that develops slowly and gradually over a long period of time may be relatively mild.
Many people with hyponatremia are unaware of their low sodium level, especially if hyponatremia develops gradually. Experts believe, due to the nature of the condition, that it can go unrecognized. Hyponatremia can affect a full range of people, young, old, healthy, or those with medical conditions. And current research shows that it is the most common electrolyte abnormality among geriatric and hospitalized patients.
Here's your new medicine, and I'll see you back in 1 month.
And hyponatremia is relatively common, particularly in older individuals.
All right?
Dr. Myron Miller is professor of medicine at Johns Hopkins University School of Medicine and is a specialist in geriatric medicine and endocrinology.
And as a consequence, it's often ignored, particularly in its milder forms.
Recent studies show that 8 to 10% of people over age 65 who live at home have hyponatremia. 15 to 20% of hospitalized patients over 65 will have hyponatremia or will develop hyponatremia while they're in the hospital. And 50% of nursing home patients, if monitored over a period of time, will develop hyponatremia at least once in the course of a year.
It occurs so frequently that often older individuals who have hyponatremia are thought to be just something that occurs as a consequence of the old age of the individual, and therefore the hyponatremia, or at least these milder forms, often is not considered to be significant.
60-year-old Marilyn Getty and her husband Brian love spending time with their children and grandchildren. An active reader who enjoys learning about her family history, Marilyn started experiencing some flu-like symptoms a few years ago.
I had the worst kind of flu ever. I barely would pull myself out of bed each day. That it was about a week with me feeling worse and worse. I started feeling so achy and so much in pain.
Marilyn thought a good night's sleep might help her and went to bed early. Her husband Brian checked in on her.
The third time he came in, I was unconscious. So he picked me up, carried me out, put me in the car, and took me to the emergency room.
After hours of tests, doctors discovered that Marilyn's sodium and other electrolytes were dangerously low.
I woke up about a day later in intensive care, wondering where I was. They said that my sodium had gone down, my potassium, all of them, magnesium, phosphorus. I didn't even know I had phosphorus. And that was low too. I had a whole bag of it hanging on my rack.
When hyponatremia develops, it serves as a marker for something else that's taking place. And the something else that's taking place may be the presence of any one of a number of diseases.
Diseases like kidney disease, heart disease, liver cirrhosis, thyroid disorders, Addison's disease, brain disorders, and cancer. Also, hyponatremia can be caused by many different types of prescription drugs, including diuretics, some medications used to treat seizures, and certain antidepressants called SSRIs. Consumption of too much water during extreme athletic events, such as marathon races. And a disorder called the Syndrome of Inappropriate Antidiuretic Hormone Secretion, or SIADH. Marilyn's doctors couldn't pinpoint the cause of her hyponatremia, but her sister, a retired Army nurse, knew a doctor who could.
So here we have the MRI images from her Fairfax admission.
Dr. Joseph Verbalis is a professor of medicine and physiology and is the chief of endocrinology and metabolism at Georgetown University in Washington, D.C.
Mrs. Getty has a chronic form of hyponatremia. She's had it for many, many years. It's due in her to an intrinsic kidney disorder that renders her more susceptible to retaining fluids in the presence of vasopressin secretion, which she has inappropriately. So she has the syndrome of inappropriate antidiuretic hormone secretion.
Antidiuretic hormone, also known as vasopressin, is a hormone that's produced in the pituitary gland located at the base of the brain. This hormone acts on the kidney as a faucet to turn on and off the ability of the kidney to retain water. If there's a deficiency of the hormone, then the kidney loses fluid. But if there's too much of the hormone, then the kidney will retain water, leading to hyponatremia from dilution of the sodium in the body by the excess amounts of water.
When you're out on a hot day not drinking,